The decision to transfer a critically ill patient between hospital sites is a complex one and should be made at a senior level. In general, we avoid such transfers when they're not in the patient's direct clinical interests, but sometimes patients need to be transferred, either due to a lack of local beds or in order to maintain access to tertiary services. Once a decision to transfer has been made, there are some important legal and ethical issues in how that process is carried out. The following question and answer session addresses some of the most commonly asked questions by junior staff undertaking critical care training with the network.
What a pleasure. I'm absolutely delighted now to be joined by Pascal and Sue, and we're going to talk about the legal issues with the patient transfer. So, ladies, welcome. What are some of the main ethical considerations?
The ethical considerations we need to take account of is respect for the patient's wishes, doing no harm, doing good, and social justice and equality for all. And ultimately, when we make a decision about transfer, it should be at the level of the consultant who makes the decision to transfer the patient.
So Pascal, whose responsibility is it to decide on the transfer?
The responsibility for transfer lies with the ICU consultant in charge. They need to ensure that the staff who are undertaking the transfer are appropriately trained.
How does that responsibility evolve into the transfer itself?
Well, the transfer team have overall responsibility during the transfer process until they have handed over to the receiving team. Then the responsibility of the patient lies with the receiving team, but until then it remains with the transfer team itself.
So Sue, who takes responsibility for the equipment during the transfer?
The responsibility for the equipment lays with the team doing the transfer, as does the responsibility for that team being adequately trained to use that equipment safely and effectively.
What legal cover is available during a transfer?
The cover for staff travelling in an ambulance from a hospital is the same as it is for them when they're working in their own hospital. So they're covered under their own professional indemnity and insurance, and the trust covers them on the trust's third-party liability risk insurance. So it is exactly the same as if they're working within their own hospital.
So can you help me sum up these issues?
So the decision to transfer is based on sound ethical principles that we discussed. It's about meticulous documentation and thinking about who's responsible during the transfer.
And it's important that staff recognise that they should conduct themselves in terms of safety and their own conduct in the back of an ambulance exactly the same way as they would do in their own hospital. And if there are any incidents or any causes for concern, they should be reported and documented appropriately as soon after the transfer as possible.
Well, thank you both very much indeed for joining us today. Thank you.
Okay.